Hello, I'm Dr. Nadia Krupp, Director of the Riley Asthma Care Center at Riley Hospital for Children at Indiana University Health. During this video, I will explain how asthma medications are given to children and how to properly use spacer devices to administer asthma medications. Asthma is a disease in which the breathing tubes that carry air down into the lungs become inflamed, swollen, and clogged with extra mucus. The inflammation also irritates the muscles around the breathing tubes, which makes those muscles tighten. With the right asthma medications, your child's asthma can be managed so that asthma symptoms occur only rarely without bad asthma flares, and your child can fully participate in physical activity. There are two groups of asthma medications: quick relief or rescue medication and long-term control medications. Quick relief medicines relax the muscles around the airways to make breathing easier and typically last around 3 hours. Long-term control medicines reduce the swelling and inflammation in the airways and can reduce the amount of mucus in the lungs. Your child's doctor will develop a management plan for your child's asthma called an Asthma Action Plan. The Asthma Action Plan is a summary of your child's asthma care and includes medications, dosages, triggers to avoid, and whether any precautions are needed for exercise. Once your doctor has prescribed your child's asthma medications, the next step is to make sure that you are giving those medications effectively. Most asthma medications are taken by inhaler. Inhalers can be given to a child of any age, even an infant or toddler. Inhaler medications are best used with a spacer device regardless of the patient's age. However, the type of spacer needed does depend on the age of the patient. First, we will review how to use a spacer device with a mask, which is typically used for a young child. Look at the spacer to make sure there is nothing inside it that your child could breathe in or choke on. Then, shake the inhaler, remove the cap, look inside the inhaler to be sure nothing is blocking the opening, and insert the inhaler into the back of the spacer. Place the mask on your child's face and ensure that you are making a good seal. The mask should fit from about the middle of the nose to the chin. Your child can breathe easily through the mask. Press the inhaler and watch your child take 6 to 8 breaths in and out for each puff. If there is a flap on the spacer that moves when your child breathes, that is the best place to watch. After 6 to 8 breaths are done, take the mask off and wait for about a minute to let the medicine settle in the lungs before doing the next puff. Then put the mask back on and repeat until you reach the prescribed number of puffs. After taking an inhaled steroid medication, have your child take a drink or brush their teeth. Once a week, take the spacer apart if it comes apart and wash it in warm soapy water, then allow it to air dry. Do not boil it. Some spacers can be cleaned in the dishwasher, but not all. When you wash the spacer, it is a good idea to clean the inhaler too. Check your inhaler instructions for how to clean the inhaler so it does not clog. If your child is nervous about the spacer and mask at first, try letting them hold it and play with it a little to get used to how it feels. Most children get used to the spacer and mask quickly. It may help to count the breaths out loud with your child so that they learn that when they get to the number 6, they are done with that puff. Next, let's review how to properly use the spacer with a mouthpiece. This type of spacer is typically used for older children and adults. First, examine the spacer to make sure there is nothing inside it that you could breathe in or choke on. Then, remove the cap from the inhaler, shake the inhaler, look inside the inhaler to make sure there is nothing blocking the opening, and insert the inhaler into the back of the spacer. Breathe out, then place the mouthpiece in your mouth, making sure your teeth and lips are around the outside of the mouthpiece, making a good seal. Press the inhaler, and then take a steady, long, deep breath in through your mouth, not your nose. If the spacer whistles, then you're breathing too fast. When you have breathed in as deeply as you can, take the spacer out of your mouth and hold your breath for 10 seconds. Then breathe out again and breathe normally. Take a break for about a minute so the medicine can settle in your lungs, then repeat for the number of puffs prescribed. Once a week, take the spacer apart, if it comes apart, and wash it in warm soapy water. Then allow it to air dry. Do not boil it. Some spacers can be cleaned in the dishwasher, but not all. When you wash the spacer, it is a good idea to clean the inhaler too. Check your inhaler instructions for how to clean the inhaler so it does not clog. Over time, you and your child's doctor will work together to keep your child's asthma under good control so that asthma symptoms are infrequent and your child is able to participate fully in physical activity without limitations. Together, you and the doctor can manage your child's asthma so that your child grows up healthy and active. If you have any questions about asthma, please contact our expert staff. To learn more, please visit iuhealth.org/Riley/asthma education. Thank you for choosing IU Health as your healthcare partner.